That was fun. I think Chuck Todd is here, but I don't really know. Chuck, are you there?
Don't mess with the cool graphics, Dylan.
Sorry,
man.
I mean, listen, I got the graphics. They say there's no Chuck. No, there is Chuck.
I'm always here. I'm omnipresent. I feel omnipresent.
I'm talking through my crazy spaceship graphic we work so hard on. What's going on with healthcare?
Well, as we were discussing at the top of the last one, at this point, when it comes to the politics of this thing, it's all about one person, Max Baucus. He's chairman of the Senate Finance Committee, and really it's almost like a game of Where's Waldo, which is where's Max? Where's his plan? Why hasn't he come out with it? Where's his opinion on how to fund this thing? Because no matter everything we've talked about, and I know we've had a spirited conversation about this House plan that's coming through and the potential that there would be a surcharge on millionaires and then a surcharge on folks that make over $300,000. Well, that funding mechanism may be just a moot point once the Senate gets its hands on it. But that's the point. Max Baucus is the guy. Everybody's been deferring to him. The White House has tried to defer to him. Senate Majority Leader Harry Reid has tried to defer to him, and he still doesn't have a plan. It's frustrating Democrats in Congress, and it's frustrating people over here at this building.
Elliot Spitzer, back in the conversation. Gavin Pallone, Ezra Klein. You were talking single payer in the last time we talked about this. When you look at the current proposal, what does it do for quality? How is single payer different for the actual quality of health care? The big concern is, well, hang on, my health care is I'm not going to be able to see the doctor. I'm not going to be able to see the doctor I want. My quality of care is going to go down.
I think
one of the
really,
fears.
That should not be the concern, because really how you handle payment from patient to a doctor to a hospital shouldn't affect quality. We have to separate the mechanics of payment versus the quality of medical care that we receive. I think the issue that we're not focusing on, though, here, we've had all these agreements. Pharma's going to take a cut of X, hospitals are going to take a cut of Y. Those numbers usually do not result in the long term. And this is where Gavin's concern comes in. Costs have grown inexorably, and the reason for that is technology gets better. Technology is expensive. We all want access to all of those types of new care that make it possible to get better faster, keep people alive longer. And as we have benefited from that new technology, it gets exponentially more expensive year by year to pay for all this. We haven't figured out how to do the ugly thing, which is to ration health care. Nobody wants to do it, and politicians certainly don't want to do it.
Well, the government's going to be the one that ends up doing it, right? There's somebody in England in their system where they say, listen, one eye for you but not two, one toe for you but not two. We're pulling the plug. All the things that they do.
We don't want to admit that we do it. We do it in different ways, and it's all hidden from the public.
Senator Scott Brown, are you there? No. Yes, no, maybe so. Ezra.
Yes, I'm here.
Senator?
Hello.
Hey, how are you?
Yes, Dylan, I'm here.
Hey, nice to see you.
How are you?
Welcome to the meeting.
Nice to see you.
Nice to see you.
Thank you. I've been listening. It's a very interesting conversation.
Well, why don't you make it more interesting for us? Your views on Massachusetts' efforts to create mandatory health care, what worked, what didn't work, and how you would make it different if you were to try to scale it beyond a single state.
Well, it's been interesting looking at what the Senate and the U.S. Senate's doing. They're really mirroring what we did a couple of years ago through Governor Romney's leadership. We had a bipartisan plan that was carefully crafted to make sure that everybody's interests were taken into consideration, business, providers, individuals, and obviously the Commonwealth. And we have a plan, as I said, it's somewhat similar to the federal plan. But the problem is, you have a new administration, and a lot of those assessments are now being borne and increased to the providers and to the actual businesses.
But let's just look at Massachusetts as a laboratory that we know. In other words, it's a state that where you stepped in and said, listen, everybody's got to have health care. We're going to create a law that says mandatory. What has been the biggest problem in Massachusetts thus far doing this? In other words, whether it's the tax burden on certain constituencies, quality of care, all those things.
That's pretty easy. It's costs, because without the federal stimulus dollars and the federal waiver money backfilling our plan, it would fail. And, you have really great plans. We've gone from 10% uninsured to 2.6 million people uninsured, 2.6% people uninsured. So it's worked, but it also has its failures.
We're paying a lot of money. Hang on one second, Elliot. Ezra, go ahead.
Yeah, I think, earlier in the hour we had, I believe it was Representative Pallone talking about, a small business. And
well, he's not a representative. Don't listen. He's enough of a pain in the neck, without being a representative.
Either way, I think he got something wrong. But I think the central thing we're not talking about enough in this discussion is the central inefficiency of healthcare is the employer role, right? Why does his restaurant make burgers and provide healthcare? Why does my newspaper provide a newspaper and provide me healthcare? Everything is routed through employers, and it's a problem. So Obama comes on and he says, if you like what you have, you can keep it. But the central question of healthcare reform that isn't being asked is, what if you don't like what you have, right? In trying to preserve the employer-based system, we're going to make it hard for people with employer-based insurance to get something different or something better. Some people, like Senator Ron Wyden, have proposed alternatives to that, but the political system is very wary because they're worried they're going to get attacked on the idea that, if 20 million people want to change their insurance, the Republicans will say, oh, you're going to lose what you have.
Elliot, and then Gavin, I'm coming to you. Go ahead.
Ezra's right. It's a historical anachronism that we provide health care through employers. It began during World War II when unions negotiated for it, and we never moved away. We should. It doesn't make sense. I think the Massachusetts lesson is that you can impose mandates. It can work, but the cost goes up. Massachusetts, I believe, Senator, tell me if I'm wrong, is on the cusp of narrowing eligibility and eliminating a huge swath of people from coverage so that the number of uninsured will go from the very low 2% up to something higher. That's because costs keep going up year after year. Till we get cost control, none of this will work.
Representative Pallone, are you there?
I'm here.
Nice to well, that's your new title. We'll call you Representative Pallone.
It's going to stick. Someday I will be.
I believe it. Listen to me. If you were to go with an Elliot Spitzer proposal, single payer, that if we accept the fact that a guy making hamburgers or a guy publishing newspapers or GE, which paid for this lovely table for us here at 30 Rock, should not also be in the healthcare business, is there a conversation to be had there from a conservative standpoint, from a small business owner standpoint of view, that you would be willing to support and or develop?
Not only would I be willing to support and develop, I'd be willing to pay for it with tax dollars. But the first thing that has to take place is we need real leadership in Washington to go and take on the entrenched interest. The only way that we're going to make all of this work, because obviously we could cover everybody if we just spend an infinite amount of dollars, is we got to bring costs down. And if you look at other countries where they have brought costs down, and they haven't done that in Massachusetts, it's managed care. So we're going to have to create a base where we say this is the level of care that we're going to provide to everybody, and if you want more, your employer or you yourself are going to have to pay for a better plan. And that's going to have to look like an HMO. And there's nothing wrong with it. I participated in an HMO. I have an HMO for some of my employees. My grandparents were in an HMO. It does work. You can't choose your doctor, but people in the military can't choose their doctor, and they get a very high level of care.
Elliot,
and the second thing that can I throw one more thing in?
One more, quick.
Tort reform, okay? There's a lot of costs in this system that take place because doctors are afraid of being sued, and because there's a lot of money that they have to pay out in insurance because they're going to be sued down the road.
I want to come back for that because we got 2 hours. We're going to do healthcare for weeks to come. But very quickly here.
You are right. Let me tell you, we tried in New York when I was governor. We said we pay more per person on Medicaid than any other state in the nation. We tried to change that by fundamentally changing the way healthcare was delivered. We were attacked by both 1199, the union that said we're going to lose jobs in the hospitals, and the hospitals themselves that said we're going to see our revenue streams cut. We said, of course you are. It was a massive onslaught, $10 million of TV ads against me personally. We succeeded in getting about 2/3 of what we wanted, but you are right. It is a vicious, vicious fight because you're trying to take money away from certain groups that are used to getting money and eating out of that revenue stream that funds health care.
Ezra.
That was inaccurate. What he described the French system, but of course you choose your doctor there. You choose your doctor in Canada, you choose your doctor in Netherlands, and Sweden. You do it everywhere. Very few of them use managed care. They probably should. I think managed care is better than what we have.
You're saying it was inaccurate when Gavin said that HMOs don't let you choose your doctor.
No, not when he said in other countries, the way they've brought costs down is you don't get to choose your doctor. It's just not how it works.
So how, Ezra,
you have managed care in those countries?
They bring costs down the same way Walmart brings costs down, right? It's a large pool of customers, and they bargain low costs. That's why our seniors go to Canada to buy drugs for a lower price than they can get them in America, because the Canadian government has, whatever, 50 million people, 60 million people in one plan, and they say, you can sell to all of them at once if you give us a good deal. That's pretty much how they do it in other countries, but they do get to choose their doctor.
All right. Again, the nice thing is, who's that, Scott?
Yeah, Scott, the part of the problem also is Massachusetts is a little unique. We're a little bit more liberal. We, agree on this issue. But you have some states that their uninsured folks are, 40, 50%, and to ram this program down their throats is going to be problematic.
Yeah. All right. Listen, we'll come back again. Like I said, 2 hours.